Greetings, everyone, and welcome to the WCEG Network. On the WCEG Talk Radio, we are a worldwide community empowerment group where we speak live into the community. I'm Dr. Babs, your host for this evening's segment on our holistic perspective. It's going to be another enriching time of empowerment, education, and encouragement as we discuss National Kidney Month, the top 10 strategies to keep your kidney healthy. So I'm super excited that all is going well. So we are going to go ahead and get started. We have a lot that we're going to be talking about today. So we are live on all our social media online streams, Twitter, YouTube, Facebook, and of course our talk radio show. So please tag your friends, your neighbors, so that you stay in tune with all that we're going to be talking about today. But before we get started, before we start this enriching period of just educating you about all the things that you need to know, I have two quick important considerations. So the views that are expressed today by the host or their guest are not necessarily views of the network itself. And I also want to mention that even though this information is to encourage you on your wellness path, it should not substitute your one-on-one interaction with your physician. So please stay in touch with your physician. So let's get started with our inspirational quote. I love to always start with one. And this one actually is very intriguing. It is by Henry Beecher. And it says, "The body is like a piano and happiness is like music. It's needful to have the instrument in good order." So let's just pause on that. What does it mean? It means that this body that we live in is our temple. This is where we live. We only have one body to live in, so we need to align it appropriately that it will serve us. So that's my inspirational quote today. And I know that you are listening because you want to be healthy. You want to not just be happy, but live a healthy, long life. So I want to thank you for tuning in, whether you're just listening currently on live or in a replay. It's all going to serve you well. So let's get started. Again, I'm Dr. Babs. If you're just tuning in, I'm your host for this evening's segment on the holistic perspective. We are going to be talking about all things kidney. This is National Kidney Month. And so we're going to dive into a few things here. What is the function of your kidney? We're going to do a quick overview of causes of kidney disease. What are those risk factors? What are some of the symptoms that you would feel or observe if there's a kidney issue going on? And then I'm going to talk to you about how you can monitor your kidney, as well as how you can maintain healthy kidneys. And if for any reason there's already a diagnosis of kidney disease, how can we prevent a worsening condition? So I have a PowerPoint that I want to share. Let me go ahead and get that up and running. That helps to keep me on track so that I'm mindful of your time. So let me share that with you. Go ahead. Okay. So again, we're going to be talking about the top 10 ways to keep your kidneys healthy. I'm going to start again by just mentioning our presentation goals, which I'd already mentioned. So why is it important? Why do we have to pay attention to our kidneys? So our kidneys actually play a significant role in our bodies, and I'm going to talk about what those roles are. But it is so important because 1 in 3 people actually have kidney disease developing, and they have no idea of what's going on. So it's estimated about 33% are at risk of developing kidney disease, and 30 million currently have kidney disease. And this is statistics from the CDC for the United States. So what are the functions of the kidney, you might ask? I know generally we know that the kidney helps with, filtration, right? So it gets rid of waste material. So that's the one that we all commonly know. We know that it gets rid of toxins, the urine waste, but it does so much more than that. It also helps with regulation of our red blood cells production. So it does that. It also helps with acid-base balance. So anytime you hear people say something about potassium, sodium, phosphorus, all those minerals, it does help to regulate that. What else does it do? Something major, bone, yes. So it helps with regulation of the bone mineral metabolism. So all the, the calcium, all of that, it's all handled by the kidneys. And regulation of blood pressure is also so important. So that's why you hear if there is hypertension, then subsequently there might be something going on with the kidneys. So the kidneys does a whole lot more than just excretion of waste material. So that's why it's important that we need to pay close attention to the function of our kidneys. So the question then will be, so what causes kidney issues? I've had that question asked numerous times by patients. What causes kidney disease? How will I know? Well, let's start off by saying that diabetes is the #1 cause of kidney disease. There's so many other causes, but diabetes is, as you can see, about over 40% will be coming from diabetes. Other causes could be high blood pressure, which is one of that I alluded to earlier on. You do have other causes, so things like medication, particularly the ones that we call NSAIDs, so the ibuprofen, naproxen. So medicine, pain medicine in particular, can cause kidney damage. There are other things like lupus, there are things with the kidney disease. Genetics can also be one of them. So there are quite a bit of other causes, but the main one is definitely diabetes and hypertension. So let's talk about symptoms. How do I know? How do I know that I have a kidney problem? Because it's like hypertension, a silent killer. You don't know what's going on. And by the time you find out that something is going on, it's already advanced. So the reason why you're listening and you're tuning in today and you want to be knowledgeable about your kidneys, because you want to know how can you prevent it. Prevention is better than cure. So the symptoms that you need to pay attention to, most of them might be stomach pain. You might have back problems where the kidneys are located. Sometimes, depending on how severe it is, you could be vomiting, you could have nausea. Now, all these symptoms needs to be non-specific, right? Because this can happen with just anything. Blood in the urine can be a sign that there's something going on with the kidneys. Sometimes just dizziness, because as you recall, I mentioned some of the functions of the kidney, right? So if there's backup of all the waste materials, that's where the nausea comes in. That's where the dizziness, when you have electrolyte imbalance, it's just not where it needs to be. All of that would lead to some of the symptoms. But again, it could really just be nothing, because it depends. The kidney is one of those organs that is so forgiving. It's like the liver. It will take so much and so much. And then it's just like, I can't handle this anymore. And then you begin to see those symptoms. You begin to see the signs in the body when they examine you. Now, so those are some of the symptoms. It's not limited to this, but these are the common ones. Sometimes you could have non-specific symptoms and signs where they say, I'm just drinking a lot, I'm peeing a lot. You go to the bathroom and you feel like, why am I going again? You're always peeing, you're always drinking. So there are numerous symptoms, but I want you to understand that there might not be any symptoms at all. All right, so it really depends on what is the cause of the kidney problem in the first place that will determine the kind of symptoms and the kind of signs that will present. So now we've come to the part where you might have some complaints and you tell your doctor, or you might not have any at all. It doesn't mean that you shouldn't check your kidney function. That's the best way to find out what's going on with your kidneys. It's really what we call a renal function panel. So that is drawn by blood. It can also be seen in the urine. So this is where we encourage you to be your own advocate. Always ask, what test are you doing today when you go to your physician, whether it's for a well visit, an annual physical, or a regular follow-up? You always want to check in and see, when last did you check my kidneys? You want to ask specific questions, and those are the questions that I'm going to go over now with you. So what we call the eGFR, it's our estimated glomerular filtration rate. That gives us an idea of how well your kidney is functioning, how well it's excreting the waste material. So always ask for that, because there's a range, and I'm going to show you on the next slide what that range should be. You would hear, probably you've already heard, your BUN. right? Your creatinine is how fast the body is breaking down toxins. So creatinine is one, albumin is one, potassium, I'm sure you've probably heard that. What's your potassium? What is your sodium? What's your phosphorus? These are functions that give us an idea, depending on how high or low it is, will determine how well your kidney is functioning. So ask for these numbers. Be your own advocate. Ask your doctor, even if they say it's normal, ask for specific. Ask, what are my numbers? What exactly is it? And of course, you want to make sure that you're maintaining a healthy kidney lifestyle. So this is the other part that I said I want to talk about, the GFR. You might have heard it before, GFR. What does it mean? Again, it just means your glomerular filtration rate. It's how well your kidney is performing, right? So, you know, it's just like when you were in college or in school, the only way that you know if you're going to the next level is if you pass certain courses, right? So it's the same thing with the glomerular filtration rate. The estimate gives us a staging of your kidney function. So stage 1 is if that number is greater than 90. So we like to see greater than 90. That's normal. Nothing is going on. It's fine. But when you get to stage 2, that's when you now become less than 60. This is where we begin to get worried. There's some loss in the kidney function. As you can see in the diagram, the function begins to diminish. By the time you get to stage 3, it's getting to about 30 to 59. And then when you get to stage 4, even further damage is where you have severe loss of function. And stage 5 is, unfortunately, where your GFR is less than 15. So again, ask your provider, what is my kidney function? What is my creatinine? What is my GFR? Because by the time you progress to all these stages, unfortunately, the treatment at that point would be dialysis or a kidney transplant. So that's why, again, I'm a strong believer of prevention is better than cure. So know those numbers so that you know how to prepare yourself and, of course, to take the appropriate treatment to reverse. Because lifestyle takes care of lifestyle-related diseases, and kidney is one of those. It is reversible. So even if you find out that you're in any of the stages, it is reversible following the right therapy. So what is the right therapy, you might ask? I'm sure you've probably heard this time and time again, but I want to emphasize how important it is to follow these tips to prevent, to treat, and possibly reverse kidney disease. This is National Kidney Month. We want to have healthy kidneys that will serve us a long time, keep us healthy and strong. So salt. We've heard it over and over. Salt could be good, but in excess amount, it's not good because you're putting so much burden on not just the heart, leading to high blood pressure and so much retention of fluid, subsequently affecting the kidneys. So we have to have a low salt diet. Now, how do we have a low salt diet? When there's salt everywhere, right? Salt is practically in everything. So the best way to have a low salt diet is to pay attention to what we eat. If we make sure that you're not a salt shaker, so you always add additional salt. So if you're preparing your meals at home, use more seasonings that don't have, that you're not relying solely on salt, right? So garlic, ginger, cayenne pepper if you can tolerate it, black pepper, turmeric, all those things season your food that you don't have to rely on salt. The recommendation from the American Heart Association is actually about 1 teaspoon of salt, which is about 23 grams. Now, if you already have high blood pressure or kidney, then it's much lower than that. So it's about 1,500 grams. You have to be very, very, very careful with that because, again, everything has salt. And the things that have salt the most, processed foods. Eating out a whole lot. That's just the truth. When we eat out a whole lot, unfortunately, they do not pay attention to the restaurants. They're trying to preserve the food. They're not paying attention to the salt content. So that's where you find a lot of the sodium. So we have to be very mindful of how much salt to prevent kidney issues or worsening of kidney. Now, nutritious food, can't say enough of this. When we eat more whole foods, foods made from the soil, made from God, not man-made, It definitely gives us all the nutrients that is needed for the kidney to function appropriately. Like if you recall, I said the kidney helps with red blood cell production. Red blood cell helps us, keeps us going, keeps the oxygen running, right? So we need to have nutritious food to keep that kidney healthy. The right environment will keep the kidney striving and healthy and strong. So what does a nutritious food look like? Definitely whole foods. So more fruits, more veggie. I will emphasize more veggie than fruits. Fruits are good, but if you're doing fruits, more of the berries, because they have a lot of antioxidants. They help with all the nutrients that we need in our body. So you want to make sure that you're minimizing processed carbs. So with your carbs, you want to have the healthy carbs, whole grain. So it used to be whole grain. So those are the things that we emphasize in terms of nutritious food. So it's not calorie dense, where you have all the sugar, the desserts. We have to pay close attention to those because they're not nutritious for the kidneys. Now, when we get to another aspect of nutrition, it's the liquid. What do we drink? How do we hydrate our kidneys? So we are made 70% of water, and without water and proper hydration, you guessed it, we cannot function the way we need to function. We're fatigued, we're tired, everything is sluggish. So we need to be hydrated, but hydrated with the right fluid, which is water. Water is what helps the body function at its best. It helps to aid the excretion, and it helps to aid with the hormone production that helps with our joints, our bones, and the red cell regulation. So that's so important. So hydration, hydration, hydration. Now, how much water should I drink? That is specific to you in terms of what you weigh. It's always recommended at least half of your body weight. Now, if there are reasons why you can't drink more than that, definitely have that conversation with your provider. Sometimes patients have kidney disease, depending on the stage, or if they have congestive heart failure, they might limit how much water you're able to drink. So, but the important thing here is before even getting to kidney disease, and that's why we're having this conversation, is make sure you drink water. If you have to set an alarm to remind you to drink water, please make sure you drink water. I have my water here. I've been sipping on it all day. And I have a goal to attain to keep me hydrated and keep my kidneys functioning well and keeping my GFR stable. So what are some of the other tips? Now, these three that I want to talk about, very, very important, because again, as you recall, I said diabetes is the #1 reason for kidney damage. Diabetes is where you have high sugar in the bloodstream. It's not supposed to stay there. It's supposed to be uptake to be used as energy. But if you have excess, then there's just this dysregulation with the body's insulin. It becomes resistant. It's too much work for it to do. And so the blood is thickened with sugar. So what does that do to the kidneys? Very fast way to damage the kidneys. It causes a lot of damage along the lining, so it doesn't work as well as it needs to. It doesn't get the supply that it needs, nutrient supply, because if there's thickened blood with sugar, the nutrients are not able to circulate the proper way. So we definitely have to make sure that we pay attention to high sugar. If you have diabetes already, to do your very best to get that under control. And the way you get that under control, of course, nutrition, cutting back on processed foods, all the carbs tend to cause a lot of that. But if you eat whole foods, whole carbs, veggies, be very particular about the kind of fruits you eat, that will reduce how much glucose and sugar you have. Another aspect that you can keep a close eye on is blood pressure. Blood pressure is so important. The higher it is, the more pressure you're putting on the vessels. More pressure on the vessels, it subsequently affects the kidney. So we need to keep the blood pressure under control. Normal is less than 120/80, but let's say there's already blood pressure issue. You definitely want to keep that under control. And there's so many things that you can do to keep blood pressure under control. Definitely what you eat matters. Our nutrition, reducing stress, and I'm going to talk about stress because it's one of the tips for keeping your kidneys healthy. So you want to make sure you cut back on salt, you cut back on stress, you're sleeping, all those great strategies, lifestyle habits that would keep that blood pressure under control would definitely subsequently help your kidneys. High cholesterol, as you can see in this picture, right? You see that vessel is clogged up. When there's high cholesterol, that tends to come from saturated fats. So you're eating a lot of saturated fats coming from pork, beef, a lot of oily foods, the hydrogenated oils, lots of fried foods. So that's why we always say do more of bake, grill, boil versus fry, because unfortunately, truth be told, when we fry, when you eat out and you eat out, you have a lot of fried foods, they don't fry foods with the best oil. No, they don't, because it's cheaper, unfortunately. And so they're just not going to do that. So you really want to minimize how much fried foods that you eat, because you don't want to have dietary cholesterol. Now, our body naturally makes cholesterol, and it's important because it helps with the lining of our different membranes. It helps with a lot of function. But when we eat, when we have high cholesterol from foods that we eat, all it does is clog up the artery. And imagine if the vessels in the kidney is clogged up. Yes, if it's clogged up, then it's not going to excrete the way it needs to. It won't perform the red blood cell production. It won't help with your bone formation. So we have to keep these three under control for a healthy kidney. And it is doable. It really is doable. It's one step at a time, identifying what it is that you're doing, that you can do better and improve gradually. Now, I have 4 more to go, and I want to pick on NSAIDs. NSAIDs is what we call pain medicine. You might have heard ibuprofen, probably heard naproxen. Those are common pain medicines that unfortunately damages the kidney. It does it in several ways. It causes fluid retention. It damages the vessels. So taking that over a long period of time, you definitely want to get recommendation from your provider if you should be taking it and how much you should be taking. So not take anything on your own accord. You have to know the state of your kidneys before you take it. Now, if you have high blood pressure already, and I have patients that are high blood pressure and maybe they might have osteoarthritis, joint issues, I always caution them, do not take NSAIDs, because that's going to worsen your blood pressure. Worsening your blood pressure subsequently damages the kidney. So you always want to look for, now I'm not advocating that you should remain in pain, always just make sure that you get the right pain medicine. And if the dose needs to be adjusted, that is very well possible. So that's why it's not just your physician, your primary care. You might, if you already have some kidney issues going on, depending on the stage, you would need to see a nephrologist so that they can work together to get you on the right medications. Stress. Stress does everything to the human body. Remember at the beginning, I said that we need to take care of this body that we live in. Stress is just one of those things that we need to get rid of, because it increases all the stress hormones, and the stress hormones in a high amount over a long period of time causes injury and damage to the vessels. All right, so the vessels is what supplies the blood to the different organs, and if that is clogged up for any reason with cortisol, it's damaging gradually. It's subsequently going to damage the kidney. So whatever it is that we can do to minimize stress. Now, unfortunately, I don't have a magic wand to get rid of stress in our environment. We live in a stressful world, but we can manage it. We can be very mindful of what we're doing to manage stress. We can't change others. We can only, the only people that we have control over is ourselves as individuals. So we need to find ways to refill our cup. We have to find ways to reduce things that are overly stressing us. We have to find ways to, if it's go for a walk, journaling, meditation, gratitude, all those things help to reduce the stress hormones. I mean, there's no way you can be mad and grateful at the same time. So those are some examples of reducing stress. Always pay attention to your stress level. Always pay attention to that. Now, daily movement is definitely very helpful. Daily movement is helpful because our bodies are meant to move. We're not meant to be stagnant. We're meant to move, get that blood flowing, get it pumping so that it's not stagnant. If it is stagnant, all sorts of things happen. So if you can imagine a sewage system that is clogged up, so everything just settles in one place and all sorts of things go on. So that's the same thing with the human body. We're meant to move. So frequent movement will definitely help blood flow, reduce blood clots, will also help to maintain a good body weight, because the more weight we gain, unfortunately, causes diabetes. And so it's a cascade of things that happen. So frequent movement definitely helps with our kidneys. And then the last that I have is supplements. We have to be very careful. I know a lot of people are taking supplements, and there's nothing wrong with supplements. Just make sure you talk to your provider about them. I know that I've had patients a minimum of supplements. I mean, I'm not kidding. They would come with a bag, almost 20 supplements. This is different from even their own medicines. But the good thing is at least they're asking, should I take this? Should I take that? So you have to be very careful because some of them interact with each other. We need to know what is in your supplements. You have to be a label reader. Again, remember I said you should be an advocate for your own health. You want to keep your kidneys healthy because you don't want to end up in dialysis, which is stage 5. You don't want to end up having to be on the transplant list. So being very certain of what you're taking, how much you're taking, and having that conversation with your provider is so very important. Yes, so different herbs, even herbs, you want to be very careful. There are certainly good herbs, but depending on what's going on with your kidneys, not everyone will have to take certain herbs or supplements. Like for instance, garlic, ginger, that's fine. The ones that I'm talking about are all these like John Worths, and they have all these things that you see in the pharmacy, black cohosh. There are a lot of all those things. You have to be very, very careful. But if we're talking about food seasoning, that is quite okay. But if you're taking B complex and you're taking C complex and you're taking D and you're taking all of that, just let your provider know. Okay, that's the takeaway message. Don't take them in isolation. Don't take other people's medication because you don't know why they're taking it. I have personally seen where a patient actually had some acute kidney damage because of supplements. They were just excess supplements and they were interacting with each other. So definitely be very cautious about what you're taking and have that conversation. All right, so we talked quite a bit about some of our healthy steps. Now, let's say there's already kidney issue. How can we reverse? Because I'm all about lifestyle medicine and how we can prevent, treat, and reverse, right? And the body is capable of doing all of that if it's within the right environment. So the way to prevent worsening of kidney issue is definitely protein. You probably heard, yeah, protein is good for everyone because it helps with our muscle, it helps with cells generation and all that good stuff. But if you already have kidney damage, you have to be very careful. Depending on the stage, ask your provider, your physician, your caretaker, how much protein are you supposed to have? It varies per person. So you want to have that conversation. Don't feel like, oh, because everybody's having a certain amount of protein, that's the same thing for you. And what are our proteins? Our proteins are, either animal products, which I would say less of animal product and more of plant-based, because plant-based can also be proteinous. So you want to, beans, legumes, all of that have lots of protein. You want to make sure your nuts have good protein. So you want to make sure if you're eating protein, it has to be lean. It has to have less saturated fat because, again, you don't want to clog up your arteries. So protein intake, have that conversation. How much protein should you take? Practice low salt intake. If you already have kidney disease, very, very important. It's not going to be the 2,300 grams that I mentioned for the American Heart Association. Yours is actually going to be much, much lower. And just a teaspoon, if you ever see a teaspoon of salt, that estimates it's about 2,300, and salt is in everything. A rule of thumb, whenever you pick up any item, so let's say you picked up a can of soup, always read the sodium. The normal sodium equivalent, it should be the calorie to 1. So let's say it's 300 calories in that content. The sodium should be about 300 or less. But you find out a lot of all these boxed foods are 3 or 4 times the sodium amount. That is a lot of sodium. And the reason why that sodium is so much is because they're trying to preserve the half-life. So please, if you have to have the cans, rinse it out. Rinse out the sodium. It's been shown that helps to reduce it. I will say for me, I love all the other seasonings like garlic, ginger, cayenne pepper, turmeric, black pepper. So even if when I cook my food, if I put salt, I definitely don't. Salt is like bare minimum because my food is already flavored with other things. So please, please, please pay attention to your salt. Pay attention to your salt. I cannot overemphasize it. Yes, the body needs sodium. It certainly needs sodium because it helps to balance the sodium and potassium. But excess amount is like the body says, you know what, this is too much. I don't know what to do with it. And it causes fluid retention. Now, I don't know if anyone has observed this, and this happens to me a lot. I've had blood pressure problems in the past. I do have a family history, and I've been off medication. I'm really happy about that. I've tried my best to maintain a healthy lifestyle, but there are times when I fall off the wagon. I'm human. And so if I have, maybe I go on vacation or I eat a little bit too much salty foods because I'm eating out more, my hands are swollen the next day. And that's because of fluid retention. I can't wear my rings. I feel bloated. That is sodium. So I've had it in excess amount. So it retains fluid because sodium takes fluid along with it. So we have to be very careful. The same thing with starch. Starch takes a lot of fluid along, so you feel bloated. So as much as we need sodium, yes, in reasonable amounts for the body to function, but when we have excess, it just helps it just really puts a burden on the body. Proper potassium intake. Yes, I know that we hear, oh yeah, you need potassium, eat bananas, eat avocados. All of those are good. But if you already have kidney issues going on, if the excretion rate is already affected to an extent, you want to make sure that you have that conversation and keep your serving size. So having 2 or 3 bananas will be too much. It is high calorie fruit, by the way, bananas. Each one, the size that we have right now is 100 calories. So half a banana would be better, instead of a whole banana or eating 2 or 3. I had a patient that said, oh, well, they said we should be eating fruit, so I eat 3 or 4 bananas a day. That is too much. That is more than your serving size for bananas. So we definitely have to pay attention to a potassium intake. Now, phosphorus intake, we also have to be very mindful of that. And the question then will be, where does the phosphorus come from? Phosphorus comes, unfortunately, it is a good mineral that we need to have, but a lot of processed foods, like the processed foods, the deli, all the turkey, all of that, the way they preserve it, they have the artificial phosphorus. So you have to be very careful because that can put so much burden on the kidneys. Now, water intake, if there's already kidney damage, your water intake will be different from somebody that doesn't have any kidney issues. So you definitely don't want to follow the rule that I just mentioned, where you should drink half of your body weight in water. You definitely want to stay hydrated, but you want to find out from your physician. So please, if they haven't had that conversation with you, please, after today's session, I want you to ask your doctors, what can I do to get my kidney reversed? And it is possible. We've had patients where their creatinine levels have gone from as high as 5. And the normal is between, depending on female men, so somewhere between 0.8 to 1.0 or 1.2. Anything higher than that, then it becomes very concerning. But having these tips and abiding by them the best you can, we've seen numbers reverse significantly. So these are the items that I definitely wanted to talk with you about. And so the next thing I want to just dive into is frequently asked questions. So I've mentioned quite a bit of the frequently asked questions, but there are a few more that I wanted to go over. But I want to emphasize that there is a place on the web that I will share later on, and I can just share it now. It's the National Kidney Foundation. You can take a quiz because it will ask you based on your symptoms or what's going on with you or what your last result was or is, so that you can figure out where you are with your kidneys. So it's the National Kidney Foundation. Please check it out, either for yourself or your family member, and get an idea. March 10 was the World Kidney Day. So the good news is that we have 2 kidneys, and you can function quite well on one well-functional kidney. I'm sure you've heard or know a few people that have donated their kidneys. So if one is functioning well, that's great, but you don't want to lose out on 2 kidneys. So that's why we need to maintain the kidney, keep it in strong working condition. Now, I want to give you some information about frequently asked questions. So one question that I've seen that have come up is, well, what if I'm on medication? What if I'm on medication I've heard a lot of information about, be careful if you're on this medicine, it might cause kidney issues. What do you then do if you're on blood pressure medicine, but yet you're having kidney issues? So what you need to do with that is definitely have those conversations with your doctor. If for any reason the issue is your blood pressure is really high, then they can switch you to another blood pressure medicine. They can switch you to a dose that will not cause further damage. But don't stop your blood pressure medicine without talking to your doctor. Whichever medicine that you're concerned about, that you've heard on the news or on the radio, that it causes kidney damage, please have the conversation first. I had a patient, unfortunately, stop their blood pressure medicine because there was a recall on lisinopril, the combination lisinopril and the water pill. And unfortunately, the blood pressure was so high and they ended up having a stroke. So for that kind of patient, definitely reaching out to your doctor to voice out your concerns. Some of those side effects depends on the manufacturer. It's not every place that has that issue. So it depends on the manufacturer. So your pharmacist, your provider will be the best person to tell you if your medication is on the list with the recall. So we definitely have to make sure that you talk to your doctor. Not all the side effects occur with everyone. So another question definitely is, how well does a person function with one kidney? That's a good question. Yeah, well, functions pretty well. That's why you can easily, as long as your GFR is greater than 60, you can do very well. Again, that was why I shared, and I'm going to stop screen share now. That was why I shared what the GFR looks like. So the GFR is how well the kidney functions. So as long as that kidney function is at its optimal, one kidney, that is totally okay. So you can function well on one kidney. And then, yes, there are questions about disparity, and that's absolutely right. Health disparity when it comes to kidney disease and who gets on a transplant over the other. It is true, and there's been lots of research that has gone into changing this narrative, and the reason is because African Americans, that we have more, we tend to be more muscular, we tend to have bigger bones. So the creatinine, which is used to determine who gets on the transplant list, there's a disparity there. So a Caucasian who is not as muscular as African American might get on that list and get a transplant faster than African American. So there's that aspect, which there's a lot of work that has gone into to find other measurements to determine who will need a kidney transplant. Now, other areas where we have health disparities definitely are the chronic diseases. As I alluded to, diabetes, hypertension, those are the commonly chronic diseases that subsequently lead to kidney disease. And that's unfortunately seen more in the African American population. Lifestyle related, whether it depends on the foods that we eat, the activities, the stressful environment, and all those other things. It's a multifactorial reason. So there's several reasons there. But you see, the whole goal of this network, as you see, is to empower us all to be your own advocate, to know. If you know better, you do better. And so making sure that we are quite knowledgeable about what those risks are. Ask your family, is there a kidney disease in the family? If there is, or even if there isn't, how can we prevent ourselves from getting to the place where we need kidney transplant? Because they are all preventable. The kidney is very forgiving. You create the right environment, it definitely will strive and reverse. So those are some of the questions that I know that I've heard patients ask over the course of the years that I've been practicing, to make sure that we answer them appropriately during each visit and we monitor. Now, let's say your kidney was found to be high. How often is it monitored? That's also another question. It really depends on how high it is and what treatment was administered. You will definitely follow up with a nephrologist, and depending on their timeline and what stage you're at, they might see you maybe every 3 months. It depends on how bad it is, but definitely frequent visits will be necessary for patients that already have kidney issues. Now, if you don't have kidney issues, it might just be once a year. So you just get your screen, you get your kidney test, ask specifically for what your numbers are, and you might just check it again once a year. So you definitely don't want to say, oh, I feel good, I'm healthy, I don't need to go to the doctor. No, you need to. That's why you need to go to the doctor. All right, very good. I like these questions that are coming in. Thanks for the engagement. So there's another question about so many dialysis clinic. Oh, yes, I know. Yes, we need to change that, right? So that's why we're having this education. There's so many dialysis clinic, and I have patients that are on dialysis, and and you probably might have family members that are on dialysis. It's really not a fun thing. What the dialysis machine, and there are two types of dialysis, but not to go into specifics there, really what the dialysis machine is doing is replacing the function of your kidney. So it's flushing out all the toxins, and it takes a toll on the body. I mean, you're there 3 days a week, and every time you go, you're really sucked. And then, I mentioned that the kidney helps with red blood cells production. So you're also giving that hormone to help build red blood cells. So it does take a toll on the body. And unfortunately, it seems like the reason why we're having more dialysis centers among African-American families is because they're the ones that are needing it most. So that's why the education matters. Let us cut back on diabetes. Let us cut back on hypertension. Let us pay attention to what we're eating. Let us pay attention to what we're eating. You know how they say we are what we eat? And so how do we pay attention to what we're eating if everything is so expensive? Well, education. Not everything is as expensive as we see it to be. We definitely need to have more healthy options around and not have fast foods every little corner that we go to, because let's keep it real, whatever you have at your access is what you're going to avail yourself of. So that's why we have all these in the work where we provide, we make sure that healthy food options are available everywhere. So it's not just isolated to fast foods in African-American community, but even for African-American community to be aware of what are the healthier options, even when you go to the grocery store, because the healthy options are there and they can actually go a long way in keeping you full. If you eat a lot of the sugary and processed foods, you are not going to be satisfied. Unfortunately, you're just going to have a sugar crave and sugar crash, and you're going to be hungry. So you're looking for some more food. So the way I say it and the way I explain it to my patients is that you could eat the unhealthy thing that is $1 and you would eat it over and over again, and it would equivalent to the price if you had just bought something that was more filling, because you would not be eating too much of that. You would just eat enough. So the quality of the food matters than the quantity of the food, if that makes any sense. Yes, so absolutely. Yeah, so are you able to come off dialysis to live a normal life? Well, it does take a toll on the body. I wouldn't say never, right? I've just seen patients without the right education. So here's the thing. This is what, I help communities of color because I want us all to be healthy. I want us all to be empowered in how to nourish ourselves. The truth is, dialysis is not, the way it's been functioning is like a band-aid, right? So we just take care of the problem. But what's the root of the issue? What's the problem? Where is this all starting from? So if we take care, it's like the roof leaking, right? And you just keep mopping the ground. So if you take care of the roof, then you don't have to keep mopping the ground. So to that question, I'll say, yes, you can have a normal life provided the root of the problem is addressed. A lot of patients that are on dialysis, I have patients that I work at Grady and I refer my patients to nephrologists. Unfortunately, they're not educated about the kind of nutrition they should have. They just go for dialysis. So you just putting a band-aid, you're not really getting to the root of the issue. Patients where they're actually taking care of the root cause, changing their diets, living stressless life, exercising as best as they can, they actually do a whole lot better and they can reverse their numbers. Avoiding all those pain medicine like the NSAIDs, definitely patients in that category can actually fare well. Now, some of them might need transplant, and if that's the case, they can actually do well and have quite a normal subnormal life, but better than if, you know, it was just dialysis all through. So that's the response to that, is if you have family members, please just talk to them about talking to the nephrologist, the kidney specialist, or the primary care. What else can I do to help to reverse this kidney or prevent it from getting worse? And that's why I discussed those 10 tips. Please take them very lightly, one after the other, just trying to address them. Now, in terms of the food deserts, yes, I do agree. There are tons of food deserts. They are placed in urban communities and more than grocery stores. I know that in the area where I work, it's getting better. We used to have just fast foods restaurants, but now they've opened Walmart and Publix and Kroger's in the area. So people are advocating. So we just all need to advocate. We all need to shout out and scream out that we're tired of the narrative that we're faced with. We want to change it. We want it to be better for ourselves, for our younger generation. We want to live happier and healthier lives, and we want our kidneys to be stronger every day based on our lifestyle. So yes, that definitely so important. I really appreciate all of you just staying tuned and listening and being about your health. It takes a village. You know, they say a village raises a child. I believe that this is a great village where we're educating each other. And I'm really hoping that after today, when you have your next visit, that you don't leave your doctor's office without asking what is your kidney function. And if they tell you it's fine, you're going to ask them exactly what does it mean by it's fine, because you want specific numbers, right? Okay, so I really appreciate you all. Again, our time is coming to a wrap, and just want to encourage you that I have been blessed by this. I've felt a renewal of heart in terms of the questions that have come, in terms of making sure that we advocate more for more education in our communities, making sure that we do a better job as physicians, as providers, educating our patients about where they are in terms of their kidneys and how to prevent worsening. So I hope that you as well will take the information to not just be inspired, but to implement it. So what steps are you going to do? Are you going to make sure that when you're having dinner tonight, you drop that salt, or make sure that you try and cook more at home so that you can control what you put in your food, right? Are you going to make sure that you move? The recommendation is at least 30 minutes, 5 days a week. So that comes to about 150 minutes. Make sure that you're not just sitting all the time. Like after I finish now, I'm going to get up and go outside. It's still bright outside. I'm going to walk. So all those little things that you can do, you're definitely worth it. You deserve to be whole, to be vibrant, and to be healthy. So I want to leave you with this last nugget. It says, if your body is not right, the rest of your day will all go wrong. And that is so true. As I mentioned, kidney disease might not have any signs at all. And so sometimes we say, oh, we're healthy, I feel good, I feel right. But you want to make sure you have your regular checkup, because if at any point the body decides to break down, then it's going to take a whole lot to get it back together. So you want to take care of yourself. All right. So until next month on the Holistic Perspective on the WCEG Network, I want you to stay strong. I want you to stay blessed. And I want you to continue to advocate for yourself. Thank you all so very much, and happy National Kidney Month.